So these are certainly not all of the ways. These are just some suggestions to you about how you can prevent this accumulation of animals and this tendency toward having more sick animals in your shelters, and yet still achieve an adoption guarantee status. The first and foremost, and it may sound kind of odd that the veterinarian is talking to you about good management, but good management is key to a good health program and keeping animals healthy in that shelter. It's also key to preventing overcrowding. And we'll talk a little bit more about that in a minute. We're going to make health a high priority because unhealthy animals increase stays, which leads to overcrowding. As part of making health a high priority, we're going to have goals for that health program. We're going to pay attention to how long that animal is staying in the shelter. Where are the bottlenecks? What's slowing down that animal from the time it enters the shelter until it leaves? And then we're going to talk a little bit about how do you monitor the health of the population of animals. We know how to monitor. We know well how to monitor whether an individual animal is sick. We look for signs. But how do we know how the whole population is doing? So we'll spend a little time talking about each of these. So management. You heard a lot about management this morning from Robin and Suzanne. It is key to achieving an adoption guarantee status. It's also key to really efficiently running a traditional shelter. So you have to have good leadership. And you have to, if you think about the health of animals in your shelter, whose responsibility is it to keep animals healthy in the shelter? If you think about it, it's every single person who will handle that animal or has anything to do with that animal. It's not just the veterinarian. It's not just the veterinary technician. It's every single person in that shelter that handles those animals. Why? Because if a person handles an animal roughly, it increases that animal's stress. Stress goes up, susceptibility to disease goes up. If a person doesn't wash their hands between handling animals, going from a sick animal to a healthy animal, they can be, and probably are, the single most important mode of transmission of our infectious disease agents. So if management can impress upon every staff member that's hired and in every training program that they have a role to play in the health of the animals in that shelter, then that's what we have to do. That's going to be an effective way of minimizing disease in our shelters. And management has to do that. Your veterinarian can't talk and be involved in talking to every staff member. Your veterinary technician can't be. It has to start with the shelter manager or the executive director because everyone has to play a role. And then clear responsibilities. If you have a staff member who's assigned the task of delivering medications in the afternoon, then that person has to have the time. They can't be constantly being pulled off of. You have to have adequate staffing so that the people that you assign tasks, and I'm talking right now about health-related tasks, but it could be any particular task. If you're constantly pulling them away from it, then you're going to have animals that aren't getting their treatments. So having good management, and we talked about accountability this morning, and I absolutely agree with that. I think sometimes accountability carries with it some kind of negative punishment connotation. I don't think that's necessarily true. I think instead what you say, you have staff members who've been trained to handle animals in a certain way, to wash their hands. If they're not doing that, remind them. Not in a punitive sense. Maybe you have to if eventually they don't pay attention to you, but first of all, the carrot's going to get you a lot further than the stick. And so teaching them and reinforcing that they have a role and that they actually can control whether this animal gets sick or not. Most people coming into shelters are there because they care about the animals. Go back to your mission of caring for animals. And I also, when I listen to my behaviorists talk about positive rewards and positive reward-based rather than punishment-based training in dogs, I often think about people. Because we, in fact, even if we're training our dogs positively, we often manage our people with punishment. I think rewards can do so much more to get people to do things. Now, every once in a while, of course, you're going to have to resort to some punitive measures if the reward doesn't work. But I think we need to concentrate on managing our people in a humane way, just like we handle our animals. So, have you gotten the notion from Suzanne and Robin and myself that management really is key to moving forward with your no-kill goals?